Gynecologist, what is the most terrible thing you have ever seen? Bon appetit, not gynecologist online. Sometimes I run into unpleasant cases where a girl walks around for days or weeks with a single tampon inside. Necrotic vaginal cancer also looks pretty rough, but that doesn't even come close to the worst case of my life. One day, a 19-year-old girl came to our clinic complaining that a hairspray cap was stuck in her vagina. No big deal, naive me thought. But the catch was that she had inserted it in there when she was 15 years old, meaning 4 years ago. She couldn't explain her motivation to me, but it was clear she was extremely embarrassed. Even before she undressed, you could smell a horrific odor, which got significantly worse when I went to examine the issue. The cap had been pushed edge side up, and over those 4 years, it had become heavily overgrown with vaginal tissue. The difficulty of treating it was compounded by the fact that the cap had punctured both her bladder and her rectum. It took several extensive surgeries to remove it. I'm not a gynecologist, but I know someone who recently had a hysterectomy, uterus removal. Long story short, the girl had stitches inside her vagina that needed time to heal. But she was so impatient to get back to her sex life that she couldn't wait, broke protocol, and as a result, her small intestine prolapsed out of her vagina. Everything was described to me in such detail that I don't think I'll ever be able to eat mincemeat again. According to the girl herself, on the way to emergency surgery, she could feel her intestine resting on her leg and pulsating. How do I delete someone else's comment? Back in high school, I had a friend who was terrified of going to the gynecologist. When she finally worked up the courage to go for her first pap smear, she got so nervous that she clamped the doctor with her legs like a vice. According to her, it took quite a while before she could relax and release the doctor. It was extremely awkward. Now she laughs about it, of course, but her shyness regarding her female organs hasn't gone anywhere. She doesn't even like using tampons. I'm a medical student. Once I signed up to assist in a hysterectomy. When we headed into surgery, we were told it was a small case of ovarian cancer, but it turned out to be much scarier. All of the patient's internal organs were covered in metastases. We spent 13 hours just trying to debulk the tumors, even though the whole surgery was supposed to take about 3 hours. At several stages, general and vascular surgery teams had to step in and help. We replaced half of the patient's blood volume. After surviving all of that, she was in very rough shape and had a long, painful post-op recovery, but eventually she pulled through and went home to her family. It was an exhausting case for all of us, but both the patient and her family turned out to be wonderful people, so it was an honor to help them. I'm not a gynecologist, but I sometimes perform exams. One time I removed a tampon that had been inside for at least a month. What's interesting is that the girl was sexually active the whole time. The smell was absolutely foul. After she left, it took several hours to air out the room. We were wandering around the clinic trying not to throw up. My dad told me about a woman with a severe heroin addiction. For some inexplicable reason, she decided to get creative one day and shot up in her labia, which led to gangrene. Guess it was worth the shot.
A bit late to reply, but I'm a med student, becoming a full doctor in a few weeks, though not quite a gynecologist. During my gynecology rotation, I was sent to examine a young lady. While preparing for the exam, the smell in the room was so bad, I thought I was about to see the worst case of bacterial vaginosis ever. I go in and start examining, but I don't see any unusual discharge. Strange. I start pulling back, and I notice that the farther away I step, the stronger the smell gets. Turns out her feet just smelled horribly bad. I highly recommend reading Dr. Lissa Rankin's book, What's Up Down There? There's a chapter where she writes about the worst cases of her career, like finding botfly larvae, etc. But that's child's play. The wilder case was a woman who had a potato growing inside her vagina. Check it out. To prevent pregnancy, she decided to insert a potato as a contraceptive. Since potatoes love warm, dark, moist environments, it started actively sprouting, and eventually, potato sprouts were dangling out of her vagina. I have a story that isn't about vaginas, but it's no less disgusting. In high school, I joined a student organization that sent students to shadow medical staff. I chose to help in the ER. One time, an extremely obese woman was brought in complaining of chest pain. Everyone could smell a horrific odor coming from her. So the doctor decided we needed to wash her up and examine her. As he washes her and lifts one of her breasts, such a stench comes out that we almost fainted right there. Under her breast was a pale crust. The doctor washes it off, the scab peels away, and reveals a small hole from which cockroaches start crawling out. Most likely, eggs were laid in the skin fold under her breast, and when they hatched, the roaches couldn't find a way out, so they had to gnaw their way to freedom. My mom had a story that I think is the grossest hospital story I've ever heard. A 50-year-old patient weighing 227 kilograms, 500 pounds, walked in and said her husband complained about a strange smell during intimacy. But the kicker was that not only her husband felt it, the whole hospital did. I don't remember all the details, but it turned out her entire vagina was necrotic. She needed surgical intervention, but it didn't save her, and she died shortly after. The best part of the story is that her husband was the first to notice the foul smell, and during sex, no less. I'm not a gynecologist, but I've seen my share of wild stuff. First, I saw a woman with vaginal cancer, and then I saw what was left of her after a total vaginectomy and hysterectomy. It was not a pleasant sight. I can't describe all the exact procedures because I was just a young student. But in the end, where her organs used to be, there was just a large, gaping cavity that kept dripping. The poor woman was so heartbroken, she begged her husband to leave her, saying, "After this, you'll never be able to love me." But he was a hero. He stayed by her bedside the entire time, held her hand, comforted her, and showered her with love. You could tell he adored her. Second, we received a 220 kilogram, 485 pounds woman with lower limb paralysis. She had a massive ulcer and necrotizing fasciitis that destroyed everything in her genital and buttock area. Her rectum had erosions, which we realized because stool was leaking from multiple damaged areas. When doctors asked for a urine sample, it turned out she no longer had a urinary bladder or a vagina, just one giant cavity. The team tried to patch her up. After washing her, they flipped her onto her side and essentially started stuffing large amounts of gauze into the huge hole, hoping she wouldn't defecate during the procedure. She passed away very quickly. In cases like that, we're helpless. I feel so sorry for the first girl, too. I hope she's happy now. I feel sorry for everyone in this thread, including the readers. I'm not a gynecologist, but I was born with a defect I didn't pay attention to until I started using tampons. The issue was that I had a vaginal septum, which meant I had 2 openings instead of 1. I realized there was a problem only when I tried to pull a tampon out. I inserted it through one opening and tried to pull it out through the other, smaller one, where it got stuck. It hurt terribly, but I couldn't do anything about it. Luckily, my mom was nearby. She initially thought I was just being silly and couldn't pull it out. But then she saw what was going on and rushed me to gynecology. They operated on me, and now I have 0 issues. I worked in the ER and also saw an interesting case. An elderly woman was brought in after a fall. We started examining her, and she had massive vaginal cancer. Her pelvis looked like 2/3 of a soccer ball was attached to it. The tumor was so big that it pressed on the nerves in her left leg and cut off blood flow, which caused her fall. I don't know what happened to her afterward. They were still working on her when my shift ended. I hope they send her to hospice, because with a tumor like that at 80 years old, chemo, radiation, or surgery didn't make much sense anymore. I work as a nurse in a gynecology department. Oddly enough, I rarely run into gross stuff. Women are usually quite meticulous about their vaginas, and honestly, the vagina is a very resilient organ. It can withstand even improper care. The worst case was a woman who came in for a hysterectomy. At the start of the surgery, the surgeon made a mistake and accidentally nicked her bowel. It was decided to pause the surgery until the bowel healed. But things went wrong. The bowel cut didn't heal and fused with the abdominal incision, forming a fistula through which stool began to pass. A wound leaking fecal matter isn't easy to heal. As a result, she stayed in the hospital for 9 months, endured dozens of infections, wound breakdowns, and multi-hour dressing changes. At one point, the fecal wound was large enough that 2 of my fists could easily fit inside. It ended with her getting a permanent colostomy, and according to the latest updates, her uterus was never even removed. Well, thanks to your stories, I'll never feel embarrassed again about not shaving my legs or bikini area before going to the gynecologist. A couple of years ago, my buddy was an intern in gynecology. A young patient came in with 2 complaints. 1, she couldn't get pregnant, and 2, she had constant diarrhea. The gynecologist asked how often they had anal sex, and she replied, always. It turned out her boyfriend had convinced her that it was easier to get pregnant through the back door than the front, so she let him hit it, only from behind. A story from my colleague. A girl came in for an exam. She gets on the chair, my colleague inserts his fingers up to her cervix, and at that exact moment, a brilliant question pops into her head. Have you ever thought about how this is kind of like stuffing a turkey? My colleague, trying to keep a straight face, says, no, but now I'm going to think about it every Thanksgiving. The patient burst out laughing and then looked him dead in the eyes and started gobbling like a turkey while his fingers were still inside her. My favorite Thanksgiving story. My grandmother worked as a gynecology nurse for 20 years. One day she stormed home furious and yelled, "If I have to look into one more vagina in my life, I'm going to snap." All while breaking dishes around the house. The next day, she quit. My mom works as a gynecologist's assistant, so I've heard plenty of stories. Once, a woman walked into the office smelling like a dumpster. Turns out she had been wearing the same pair of underwear for 2 months. They were dark yellow-brown. Apparently, no one ever taught her that you need to wipe your behind. I had a very weird first visit to the gynecologist. I was super nervous, and I got an old female doctor who clearly noticed it. To break the ice, she goes, "Well, lucky for you, you didn't get a male gynecologist. Their fingers are like fat sausages," and then proceeded to insert her frail old fingers inside me. Thanks for watching. Gynecologists, feel free to drop the worst thing you've ever seen in the comments below. Don't forget to check out our other videos and enjoy your meal. Bye.